I think the witnesses should be here, but we just have a little bit of committee business to take care of first of all. And hopefully that won't take very long. Thank you for being here. Committee business is we met yesterday as a subcommittee to prioritize our 4 studies. That report has been distributed. I don't have a copy. There you go. So what do? We need a motion. Okay, so I'll read this into the record, I guess. So your subcommittee met on Tuesday, February 25th, 2020, to consider the business of the committee and agreed to make the following recommendations. That the committee proceed to its further studies in the following order. Number 1, palliative care. Number 2, primary care models. Number 3, assisted dying and mental illness. Number 4, national dental care program. Secondly, that in relation to the study of palliative care in Canada, committee members submit their prioritized witness lists with the witnesses' complete contact information to the clerk of the committee no later than Tuesday, March 3rd, 2020 at noon. That's Eastern time?
Yes.
Okay, that's Eastern time. And now, with regard to the meeting of Monday, March 9th, 2020, 1 hour be dedicated to a briefing with officials from the Department of Health in relation to the study of palliative care in Canada, and 1 hour be dedicated to the consideration of the work plan prepared by the analysts in relation to this study. And respectfully submitted, Ron McKinnon, Chair. Is it the will of the committee to adopt this recommendation? Mr. Fisher.
Thank you very much, Mr. Chair. I want to thank the subcommittee for their hard work on this. I can't let it pass that I kind of hoped that we would do the dental study first, but that is the will of the subcommittee. If that's the will of the committee, then so be it. But can always hope for a speedy committee report and off to the next one. Thank you.
Excellent. Well, thank you. Any other comments? So, seeing none, I will ask for all in favor of adopting this report. Raise your hand, please. All opposed? Carried. Is there any other business for the, any committee business before we carry on? Dr. Kitchen.
Thank you, Mr. Chair, and I apologize to the witnesses. There's a little bit of more committee work that I'd like to just get done before. Mr. Chair, I would like to my motions to bring them forward today, if I can. I'd start with pursuant to Standing Order 108-1A, that the committee order all documents, including briefing notes, memos, emails, text messages, and summaries of phone calls prepared for the Minister of Health, Minister of Transport, Minister of Public Safety, Minister of Foreign Affairs, and Minister of National Defence regarding the outbreak of the coronavirus no later than February 28, 2020.
Okay.
You can speak to the motion.
Did you wish to speak to this motion?
Certainly. I know we put this on notice earlier, and I understand there have been some discussions about it, and I think as we're dealing with the issue of the COVID-19 and how important it is that we're up on top of the facts and moving forward, it's very important for all of us to understand what's been going so that we can put those pieces together as we further look at the issue of COVID-19.
Thank you. We have now Mr. Kellaway.
Thank you, Mr. Chair. And you know, we strongly support transparency on this very important issue, but as drafted, the motion seems to put a heavy strain on the public agency and the Chief of Public Health Officer, Dr. Teresa Tam, other departments actively managing the situation. So it seems like a lot of pages, a lot of sensitive documents, you know, ranging from patient information to cabinet confidence being tabled for the public realm. So we've engaged ministers that are connected to this motion, and they're prepared to provide briefing notes and memos to the committee when requested. So we're wondering if, you know, certainly it's exceptionally important the transparency is there, but we're looking at to see if we can make some move in terms of issues related to cabinet confidence and national security, and focus on the motion, but with some modifications.
Any further discussion? I'm sorry, I was distracted. You made the motion to amend, right?
Yes.
So the discussion is on the amendment. Is there any discussion on the amendment?
Did we hear the amendment? He hasn't read
No,
it yet.
yeah.
Oh, I'm sorry.
Okay. So I can read the modifications. Pursuant to Standing Order 1081A, that the committee requests briefing notes and memos prepared for the Minister of Health, Minister of Transport, Minister of Public Safety, Minister of Foreign Affairs, and Minister of National Defense regarding the outbreak of the coronavirus no later than March 26, 2020. Then the addition would be further that matters of cabinet confidence and national security be excluded from the request, and that any redactions to protect the privacy of Canadian citizens whose names and personal information may be included in the documents, as well as public servants who have been providing assistance on this matter, be made by the Office of the Law Clerk and Parliamentary Counsel of the House of Commons. And I believe this is being circulated around in both official languages.
Okay, any discussion on the amendments? Mr. Jenner.
Okay, thanks. The service of the parliamentary secretary here passing out amendments is wonderful. I just obviously we have some concerns that it kind of gets away from the intent of the motion as we intended it to be. A little curious as to why the date also changed, February 26th. I think I heard you say what we got passed out here by your parliamentary secretary says February 28th. I'm not sure if that was just a mishap.
Did I say February?
I
believe you said March.
March 20.
Yeah.
It says here February 28th.
Okay. March. The addition.
Okay.
Never be able to do anything in 2 days.
2 days. Yeah.
Right. So I guess it kind of gets back to, again, the point of our motion was to, after hearing from a number of witnesses, some representing departments that are here in front of us again today, indicated that there's significant meetings, there's been significant working groups in the lead up to this. I believe one witness even said that each day there is a call, within all departments on this file. There's certainly a file where I think a lot of Canadians are looking for that transparency right now, because there has been a significant amount of confusion from the beginning on what Canada is doing in relation to the rest of the world when it comes to this. So we would certainly not support the removing of things like emails, text messages, and summaries of phone calls, largely because we do know, as history will show, through the SNC Lavalin communication, there was a significant number of text messages, which really was a preferred way to communicate by certain ministers and certain senior level bureaucrats. So we want to make sure that we have those three in there. With regards to the rest of the motion, the addition to it, further that matters and so forth, we are okay with that, with the exception we would remove the cabinet confidence piece of that again, because an issue as serious as this, as we have seen the nation is essentially seized with daily updates on what's going on, the reasons for full transparency and accountability, I believe, are second to none. So we would accept pieces of this amendment. However, with the pieces that I've highlighted there, Mr. Chair, I would suggest a sub amendment to his sub amendment.
Amendment to amendment.
Okay. So following along, that the amendment be amended to replace the word requests, briefing notes, and memos with the words order all documents, including briefing notes, memos, emails, text messages, and summaries of phone calls prepared. Pursuant to Standing Order 1081A, that the committee order all documents, including briefing notes, memos, emails, text messages, and summaries of phone calls prepared for the Minister of Health, Minister of Transport, Minister of Public Safety, Minister of Foreign Affairs, and Minister of National Defence regarding the outbreak of the coronavirus no later than March 3rd. Further, that matters of cabinet confidence and national security be excluded from the request, and that any redactions to protect the privacy of Canadians, citizens whose names and personal information may be included in the documents, as well as public servants who have been providing assistance on this matter, be made by the Office of the Law Clerk with the Parliamentary Council of the House of Commons. And just to quickly speak about the date that we've indicated there, Mr. Chair, is there. We put this motion on notice a number of weeks ago. This is certainly something that we've been made aware that the minister's offices have been aware of. There should be no hesitation in terms of getting that those emails, text messages, and briefing notes, memos, and summaries of phone calls, as there has been significant time in the lead up to this.
Discussion is on the amendment to the amendment, sub-amendment.
So it's still not clear to me.
So, Mr. General, as the clerk points out, it seems that you just reread your original motion.
No, sorry. Where is mine? Yeah. So we wanted to keep the.
So the sub-amendment is to amend the amendment by replacing the words requests, briefing notes, and memos with the words order all documents, including briefing notes, memos, emails, text messages, and summaries of phone calls prepared.
And the rest of it stays the same, this part of it.
Stays the same, except that to delete the cabinet confidence for the matters of deleting cabinet confidence and.
I changed the date to work.
Are we clear on the sub-amendment?
Mr. Chair, I'm not. I mean, can you read the entire sub-amendment as it's proposed?
The changes or the amendment?
Read me how, please, if you would, how it's going to read.
Okay. So pursuant to Standing Order 1081, that the committee order all documents, including briefing notes, memos, emails, text messages, and summaries of phone calls prepared for the Minister of Health, Minister of Transport, Minister of Public Safety, Minister of Foreign Affairs, and Minister of National Defence regarding the outbreak of the coronavirus no later than March 3rd, 2020. Further, that matters of national security be excluded from the request, and that any redactions to protect the privacy of Canadian citizens whose names and personal information may be included in the documents, as well as public servants who have been providing assistance on this matter, be made by the Office of the Law Clerk and Parliamentary Council of the House of Commons.
So I had Mr.
Okay, is that clear now?
Thank you.
So, Mr. Kellaway, I believe.
Just a comment, and I'm thankful for the member opposite for his comments. But in terms of transparency, obviously we're all supportive of that, and in terms of efficiency in getting to transparency, I think was equally important. I just want us to be aware that if it's my understanding is correct, if, for example, if it is the chief public health officer who has to accumulate those emails and other public health safety officials' emails and phone calls, it's actually the person, it's not staff that are doing it. So my concern is that that's going to take time away from the work at hand. That's my concern.
So we have Dr. Pulaski now.
Yeah, basically, Mike basically said what I was going to say, and that I think our concern on this side is that these are all ministries who have this added, pretty excessive burden of dealing with the coronavirus on top of their work they had before. Presumably, they're all pretty busy before. Now they're really, really busy, and then to divert their attentions away from what hopefully they ought to be doing, which is dealing with the emerging threat of coronavirus, instead diverting that to kind of doing kind of an administrative task of pulling up all these old emails and texts.
Thank you. We have Mr. Fisher, Mr. Davies, Mr. Van Bynen, and Mr. Genereux. I would also caution everyone that we are hoping to have a briefing here, so if we can wrap this up soon, that would be good. So Mr. Fisher, please.
Thanks, Mr. Chair, and Mike and Marcus said very much what I want to say. I mean, this is, the motion that, or the amendment that Mike read forward gives so much. There's no way we can do it by the 28th, but perhaps we could consider it by the 15th. We had 23 days from February 5th from the first original motion being logged. The fact that it was on the table doesn't mean that all of the departments were accumulating all those things in the expectation that this motion was going to come forward. But we certainly want to be very transparent. This is important stuff. This is important that Canadians get to hear this and see all this stuff. So I'm happy to support Mike's amendment, but won't be supporting your sub-amendment. But I love you, man.
Hey, Mr. Davies.
Well, a few things. One is we may need a friendly amendment in either event, because the language that purports to protect the privacy of Canadian citizens whose names and personal information may be included probably should be changed to something broader, or to include the words permanent residents. My understanding is that permanent residents have been impacted by this, and we wouldn't want their personal information to be disclosed. It's been my experience that speeches that begin with profound commitments to transparency often end with a conclusion that calls for less transparency. But I think that the sub-amendment actually provides a good compromise, because it has added the Liberals' concern over national security. And I have a comment and a bit of a question on cabinet confidence. I personally would support there being an exclusion for cabinet confidence, but I'm wondering if we can get a quick piece of advice from the clerk as to yes. Well, I understand that your original sub-amendment excluded national security and cabinet confidence matters, but you've taken out cabinet confidence. I think that should be in. Oh, okay. But my question would be, would that not be in anyway? Like, without us specifying, I think cabinet confidence would always be a reason for government to redact, whether that were specified or not. If there's any doubt on that, I would suggest that cabinet confidence be put back into the motion, because I don't think the purpose of this committee here is to try to get at cabinet confidences or issues of national security. What we should want to get at is full transparency in terms of helping us understand the real health issues facing Canadians. And I think that's the spirit behind Mr. Genereux's motion. I also prefer the word order. I don't know what the term requests means, but if we mean for this to be complied with, then we may as well say order, because a request can be denied. And if that's the case, we'll just come right back with another motion that says order. So if we mean to get the documents, then we should say so. And finally, I would just say that I think asking for all the documents requested as specified by Mr. Genereux, is a broader list that I think will give the committee a more fulsome picture of what's going on, but it also satisfies my Liberal colleagues' concerns that national security and cabinet confidence and privacy matters be protected. So I think that's it's a good compromise. So I don't know whether to say I'm supporting the sub-amendment exactly as written, because I am suggesting we add the permanent residence portion in, and I'm suggesting that we put the cabinet confidence back in. I'm hesitant to move a sub-amendment to a sub-amendment to an amendment to a motion. But I think if all of us agree by friendly amendment, at least on the sub-amendment to put cabinet confidence back in and permanent residence, we can at least vote on that. I understand it may not be enough for my Liberal colleagues still to support the sub-amendment, but I think we all should agree that cabinet confidence as well as protection for permanent residents should be part of the sub-amendment before we vote on it. And I would offer that as a friendly amendment to Mr. Genereux.
So we can't officially amend the sub-amendment, but we can,
I accept that.
we can,
So the way to do it would be to ask for unanimous consent.
okay, procedurally, we can ask for unanimous consent to withdraw the sub-amendment, and then Mr. General can move it as you like, right? Do we have unanimous consent to withdraw the sub-amendment?
Sorry, Mr. Chair. To what end?
So that the changes that Mr. Davies proposed can be in the sub-amendment. So do I have unanimous consent to withdraw the sub-amendment? All in favor? No? Okay. So,
I guess we'd like to get to the briefing as well. That's my only concern that
Right.
this is going on. So why don't we vote on his sub-amendment, and then we can vote on the amendment.
okay, so we can't withdraw the amendment, so we can't change it. So the vote is on the sub-amendment as moved. Oh, sorry, Mr. Van Bynen, you had a,
My questions were answered. Thank you.
okay.
I have a
Mr. Genereux, you're on the list.
I have a point of order, Mr. Chair.
I'll say Mr.
I'm unclear. There wasn't a very clear vote there, and I'm not quite clear that Mr. Fisher, because he was being distracted at the time we talked. If we're all clear on what we were trying to do, what we were trying to do, Mr. Fisher, was if everybody's in agreement that we put back in the cabinet confidence, which I think you want, and that we just clear up the Canadian citizens to include permanent residents, then we can vote on the sub-amendment. It's just that procedurally I can't amend the sub-amendment. So to speed up time, if we just allow Mr. Genereux to withdraw it and resubmit it with those changes, then we can vote on the sub-amendment. So I thought that might help get unanimous
Okay,
consent.
so do we have unanimous consent to withdraw the sub-amendment? Yes, so the sub-amendment is withdrawn. Mr. General, you wish to move your motion, your amendment, your sub-amendment?
I would, with the changes indicated by my colleague down there. I also would even look across the table and perhaps amending the date as suggested by Mr. Fisher to I believe March 15th. You said was a more acceptable date. We could certainly work within that as well. So I don't know. Do I need to read it back again? Is it? I think we debated.
I think it's clear now.
Yeah, okay.
It's clear to me. Is it clear to everyone what the sub-amendment now says? Okay.
Yeah. So at that, then I would like to move to have a vote on this, but to ensure that the vote is also recorded for the clerk's instance.
So is there any discussion on the sub-amendment? Mr. Thériault.
Mr. Chairman, I would like you to read it again, please, for us.
So the sub-amendment in its finely honed form is pursuant to Standing Order 1081, Sub A, that the committee order all documents, including briefing notes, memos, emails, text messages, and summaries of phone calls prepared for the Minister of Health, Minister of Transport, Minister of Public Safety, Minister of Foreign Affairs, and Minister of National Defense regarding the outbreak of the coronavirus no later than March 15, 2020. Further, that matters of cabinet confidence and national security be excluded from the request, and that any redactions to protect the privacy of Canadian citizens and permanent residents, whose names and personal information may be included in the documents, as well as public servants who have been providing assistance on this matter, be made by the Office of the Law Clerk and Parliamentary Counsel of the House of Commons. Is that clear? Shall we vote on the sub-amendment? No.
Mr. General has requested a recorded vote.
And we've asked for a recorded vote. Yep.
Mr. Fisher,
No.
Mr. Callaway,
No.
Mr. Palowski,
No.
Ms. Sidhu,
No.
Mr. Van Bynen,
No.
Ms. Jensen,
Yes.
Yes.
Sorry.
Mr.
Jensen Janru.
Mr. General,
Yes.
Mr. Kitchen,
Yes.
Mr. Weber,
Yes.
Mr. Thériault,
Yes.
please.
Yes.
6, Nays contre 5.
6 to 5.
So we're back on the amendment,
So we're back
but now as amended
by the sub-amendment
so it reads like this.
that reads as I just read it. Mr. General.
Thank you, Mr. Chair. Sorry, just want to make sure we get a recorded vote on this one as well. Thank you.
Okay. So on the sub-amendment, is there any,
Amendment.
sorry, on the sub-amendment as,
On
on the amendment as amended in the sub-amendment, is there any discussion? Seeing none, yes, Mr. Fisher.
So if I can get this straight, are we looking at tasking some of the busiest people in the country with all documents, ordering all documents, including briefing notes, memos, emails, text messages, and summaries of phone calls in 15, 16, 17 days? Are we really interested in as a committee in tasking the busiest people in Canada with all of this? This will be thousands and thousands and thousands of documents. This is beyond transparency. This is a fishing expedition. And I think that what we should be doing here is, again, we use the term, Mr. Davies talked about order, not request, but we've never asked for anything that we haven't received. So I feel that we should request prior to an order. And if we don't get what we seek, then order it. Use the power of the committee to order it then. I think that this is such an overreach for a committee that's been so far working really, really well, and our officials who are sitting here waiting to brief us have been amazing on short notice. We had a conversation a day and a half ago about, inviting them back because it's important. Mr. Kitchen, Marcus talked about the importance of having them here, and we all agreed. Then we have conversations where we're supposed to have a minister for an hour, and then we hear that it's important to members that the minister be invited for 2 hours. And we say, yes, okay, if that's what folks around the table want. It just feels like this is a real overreach and taking, again, the busiest people in the country and asking them to dig down from the last 4 weeks, everything that they've done, said, talked about in the telephone, everything. To me, this just seems ludicrous. But I mean, if that's what the committee determines they want, we'll task these incredibly busy people with this. But, if this isn't a fishing expedition, I don't know what is. So, I'm interested in some of the members across the way what it is specifically that they feel they're searching for.
Mr. Genereux, followed by Mr. Davies.
It's hard not to point out the hypocrisy of taking up time by just everything that we just talked about being within this amendment that we just had the committee vote on and support. So I won't litigate everything that he just went through, but at the end of the day, you know, this is the member Kellaway started his speech by saying we intend to be transparent and accountable to the full extent. We know from history shows that all you have to do is look back to the last Parliament with the SNC-Lavalin affair and seeing the number of text messages go back and forth between the minister, deputy minister. Obviously, the chief public health officer, the minister, they're certainly well staffed. As we know, they would be essentially the ones who would be going through and getting these text messages and emails. But at the end of the day, we know that this is how this particular cabinet likes to operate is through those sorts of communication. That's why it's important that we keep all of that in there to really pursue the full transparent and accountability that these members so said that they're looking for.
Mr. Davies.
Yes, just briefly, I think Mr. Fisher does make a good point about this being an onerous request. It is. But I think the onerousness of the request is commensurate with the seriousness of the issue. I think the corona or the COVID-19 virus right now is probably the number one public health issue facing Canadians, and it's on their minds. And I don't know that there's thousands of pages. He may have seen some documents I haven't seen. But it says we're after documents that were prepared for the Minister of Health and for the Minister of Transport and Public Safety and Foreign Affairs and National Defence. And, I don't know how many memos or briefing notes or phone calls were made. We're asking for the summaries that would have been prepared. The thing about accountability is that it is onerous, but we are the Health Committee. And I think that given that, I think that the government has done a credible job up to now in managing this crisis, but I think it's also fair to say that there's been some shifting sands. And I'm not even laying that at the foot of the government, but, first we weren't sure if this virus was only transmitted by particulates. Then we found out that it could be transmitted by surface. Then we weren't sure that it could be transmitted person to person. Now we can understand it can be transmitted person to person. Now we understand that it's coming into Canada not just from people from China, but maybe from Iran or elsewhere. And so I think the time has come for us as a health committee to get a very good idea of what's happened so far to help guide us in terms of doing our work as the body of Parliament that is to keep a close eye on the health portfolio. So those are the reasons that I think that the amendment or the motion is a sound one, and I'll be supporting it.
Mr. Kellaway, then Mrs. Sudu.
Thanks, Mr. Chair. Again, I've only been here 3 or 4 months, and so I'm relatively very much a neophyte here with respect to panels and committees like this that bring in experts, top-notch experts that are dealing with fundamental challenges, not just in Canada, but around the globe. When I was back home, which I go back every weekend when a flight will allow, or a snowstorm for that matter, I speak to a lot of my constituents, and a lot of these constituents tell me of the work that we're all doing here in terms of bringing the panels together to speak to health, to speak to transport, to speak to global security, and I go back to it. To me, this is transparency. This is openness. Words like order and as opposed to request. I just think it speaks to, I guess on one side, it may be people across the way may believe that that's not cynicism, but I believe that I think we're feeding into a machine here, and it's not an overly healthy one. And I'll go back to, a hypothetical here. So maybe it's not 1,000 documents. Maybe it's 2. Maybe it's 3. So we're going to ask Dr. Teresa Tam to personally go through her phone log, her texts. At the same time, we're asking for a very efficient and expeditious kind of review and a triage a very serious problem with her at the helm. Now, that was one of the original things that I brought up in our own pre-committee around this amendment. And again, when I say I believe that this committee is transparent, I believe wholeheartedly in that. That's not a qualifier. I believe that's what we're all doing here. My concern is the workload that we're going to put on individuals who are actually trying to triage this problem right now. So I kind of wanted to put that out there publicly on the record. Of course, we're for it, for openness and transparency. We have a difference of opinion here, but it should never be said that I don't think anyone on this committee is for lack of transparency. We're for transparency and efficiency and getting work done. Thank you.
I should point out that the motion is as before us. We will vote for it or not, or amend it, right? But as it stands, this is the motion before us, and this is the amendments we're going to have to decide on. So, Mr. Callaway, Ms. Saru, followed by Mr. General and Mr. Theriault.
Thank you, Chair. I just want to add on my colleague, what we are digging out as a committee. I think transparency is there, and then we are just the panels here. We really want to listen to. We are wasting their time as well. When my colleague on the other aisle, when they said they have to come back and they are here, I don't know what we are reaching out, what we are digging out from anywhere. And then other comment, they're changing because this is new virus. And as you know, WHO did not, they are just, as findings out is coming, and then we will all know it's not like Canada is going to change anything. It's just a new virus. We all don't know. There's a new researchers coming out, then we know this thing happening. So everything's transparent here. Just want to tell my colleague what is the purpose for that. I think we are wasting panel's time as well.
Mr. General?
Mr. Chair, they could end this right now by just having a vote. We have seen now three speakers reiterate arguments that were made in the arguments of the sub-amendment. So I would simply say to the members across the way that we simply vote on the matter before us. If it's uncomfortable to some of them, then I would suggest that they vote against it. However, there is no longer a majority parliament in this House of Commons. So if this is again uncomfortable to you, simply vote against it, and we'll see what the results of the vote are. But I would encourage the rest of the remaining Liberal speakers who are on the list to consider that the argument of saying that there are speakers here in front of us is certainly can be ended right away. We can move to the speakers if we simply go to a vote right away, Mr. Chair.
Mr. Theriault, allez-y.
Thank you, Mr. Chairman. First of all, I want to apologize to the witnesses because we really do want to hear from them. And since I have to go to the House, I may not hear what they have to say today. I want to try one last time to see if we can have consensus around this. I would like to propose a sub-amendment. It would add, after emails, by senior officials we would drop text messages and summaries of phone calls, and we would keep the rest. And that way, I think we need to focus on getting information. Yes, we want transparency, but text messages? I think there may be a large number. It might be maybe difficult to get hold of them. What I want is to get information. If we don't say emails from whom, we might have 300 or 400 or 500. We might be inundated by information, and I don't want that. I want to be able to process the information we receive within a reasonable time. So that would be my sub-amendment, to see if finally we could reach consensus.
What you mean, sir, about by high officials?
Well, do I really need to specify what is meant by senior officials? It says here emails, but we don't say who these might come from. We could say senior departmental officials, because that's what is meant, or those senior officials that are involved in the issue. Of course, we don't want emails from senior officials that don't have anything to do with the coronavirus. This isn't a way of trying to use up time. We don't want to be criminal investigators. All we want is the information that will allow us, when we have witnesses, to ask questions on behalf of our constituencies. Because by proposing this, after all, it seemed to me that Mr. Fisher was showing agreement with what Mr. Kitchen had requested. They hadn't given all their arguments. We all want to hear from the witnesses. I do. And I think we can find a way to come to a consensus. Could the clerk read the change that I had suggested? So we would have emails from senior official. We would drop text messages and summaries of phone calls. We would keep the rest of the text as is. Perhaps we could include emails from senior officials involved in the issue or related to the issue. So, and then we would include the various ministers and departments that are mentioned.
With Monsieur Thériault's amendment, sub-amendment, the amendment looks like pursuant to Standing Order 108.1 sub A, that the committee order all documents, including briefing notes, memos, emails from senior officials involved in the
des hauts fonctionnaires, parce que j'ai pas entendu note de service.
Did you say memos?
Well, I've dropped off text messages and summaries of phone calls prepared for the Minister of Health. Sorry, memos, emails from senior officials involved in the matter, in the file. Prepared for the Minister of Health, Transports, Public Safety, Foreign Affairs, National Defense regarding the outbreak of the coronavirus and so forth. All the rest is the same. Does everybody understand the amendment, the sub-amendment? Yeah. So I also had an indication from Dr. Pawlowski that they would like a brief suspension to discuss this.
Yes, 5 minutes to discuss them.
Would it be? Sorry, Mark.
My proposal was 5 minutes for us to consider the amendments.
Mm-hmm.
Is it?
One question.
Sure.
It's possible. For Mr. Thériault. Mr. Thériault, are you speaking of deputy ministers? I just want to clarify the the word minister. Was it deputy minister? Ministers that you were saying, sir?
J'entends pas, Monsieur le Président. J'ai pas.
I'm sorry, I didn't have any volume here. I can't hear. I can't get the interpretation right now. So, what was your question?
We're good now?
Allez-y.
Okay, so I'll repeat it anyway, and hopefully it is working, Mr. Terrio. In terms of the terminology, ministers, are you speaking of deputy ministers? I just want to clarify
Quand je
that.
vise les hauts fonctionnaires.
No, I'm talking about senior officials. So, emails from senior officials.
So by senior officials, do you mean deputy ministers and assistant deputy ministers, or
Quand j'entends hauts
By senior officials, yes. So anyone who has been part of the decision-making body, perhaps assistant deputy ministers have been more involved, but I would say yes, deputy ministers and assistant deputy ministers. That could be fine.
all in favor? Opposed? So,
So yes.
5-2. Okay, so we'll suspend for 5 minutes. back to order. Monsieur Thériault has left us in favor of Monsieur Beaulieu. Beaulieu? I'll try. So we'll start by reading the motion as amended by this Mr. Thériault's sub-amendment. So we're clear on what we're doing. So pursuant to Standing Order 108, Sub 1, Sub A, that the committee order all documents, including briefing notes, memos, emails from senior officials involved in the matter, prepared for the Minister of Health, Minister of Transport, Minister of Public Safety, Minister of Foreign Affairs, and Minister of National Defense regarding the outbreak of the coronavirus no later than March 15th, 2020. Further, that matters of national security be excluded from the request and that any redaction, further, that matters of cabinet confidence and national security be excluded from the request and that any redactions to protect the privacy of Canadian citizens and permanent residents whose names and personal information may be included in the documents, as well as public servants who have been providing assistance on this matter, be made by the Office of the Law Clerk and Parliamentary Counsel of the House of Commons. Are we clear on the motion as amended by the sub-amendment? Are we ready to vote on this sub-amendment?
Recorded vote.
A recorded vote. Okay.
Oh, sorry, Mr. Jenner.
Sorry, Mr. Jenner.
Yeah, thank you, Mr. Chair. And again, this is obviously a completely watered-down version of the intent. The intent, as we know full well through the SNC-Lavalin scandal, that the ministers communicate via text message. I'm not sure what they're trying to hide on the other side over there, because this is to remove that specifically would likely remove a lot of the pertinent information that Canadians are looking for and would look for in terms of a fully transparent and accountable government. Certainly don't support this sub-amendment, and it's unfortunate that it's gotten this far today.
Any other comments? Seeing none, we'll call the vote, and a recorded vote has been requested.
Mr. Fisher. Yes.
This is for the sub-amendment. Yes.
Mr. Fisher. Mr. Calloway.
Yes.
Mr. Pawlowski.
Yes.
Ms. Sidhu.
Yes.
Mr. Van Bynen.
Yes.
Ms. Jensen.
No.
Mr. Jenneru.
No.
Mr. Kitchen.
No.
Mr. Weber.
No.
Mr. Beaulieu.
Oui.
Mr. Davies.
Yes.
Pour 7, Nays contre 4.
7 to 5, the yeses have it.
So we're now discussing the amendment, which is fundamentally what I just read. Is there any discussion, Mr. Jenner?
No, not to belabor the point, just again ask for a recorded vote. Thank you.
Yes? So any discussion on the amendment? Mr. Van Bynen?
I'm sorry. I thought we're voting on the motion. I thought the amendment was adopted and that what we're
So
dealing
we
with now
voted
is
on
the
the
motion.
sub-amendment to
Okay,
the
all
amendment.
right,
Now we're
okay.
on the amendment.
Thank you.
And then
I
we'll go
appreciate
back
the
to
clarification.
and it'll be the same thing, probably, if this passes, I assume. Anyway, so any further discussion on the on the amendment? Dr. Pawlowski.
I'm just not sure what we're voting on. Now we're voting back on the original before it's changed, or what?
We are voting on the amendment, the amendment as amended by the sub-amendment. So what I just read at the resumption of this meeting was what we're voting on right now.
The same thing that we voted on last time.
Yes. It's processed, right? So, there you go. So, any discussion on the amendment as modified, as amended by the sub-amendment? Seeing none, a recorded vote is requested. All in favor?
Mr. Fisher,
Sorry,
Mr. Callaway,
Yes.
Mr. Palowski,
Yes.
Ms. Tidou,
Yes.
Mr. Van Bynen,
Yes.
Ms. Jensen,
No.
Mr. Genru,
No.
Mr. Kitchen,
No.
Mr. Weber,
No.
Monsieur Beaulieu,
Oui.
Mr. Davies.
Yes.
Yeas pour 7, nays contre.
Yes.
a vote on the motion as amended by the sub-amendment and the amendment, which is exactly what we just voted on. Any further discussion on Mr. Fisher?
I still think this is really onerous, but I will support it.
Okay. Any other, Mr. General?
Just again, recorded vote, Mr. Chair.
Recorded vote, okay. So we will call a vote. Recorded vote has been requested.
Mr. Fisher. Oh.
Okay.
Mr. Fisher. Mr. Callaway.
Yes.
Dr.
Yes.
Palowski.
Yes.
Ms. Tidou.
Yes.
Mr. Van Bynen.
Yes.
Ms. Jensen.
No.
Mr. Genru.
No.
Mr. Kitchen.
No.
Mr. Weber.
No.
Monsieur Beaulieu.
Oui.
Mr. Davies.
Yes.
Yeas pour 7, 7, nays contre 4, 4.
So the motion, as amended by the sub-amendment and the amendment, carries. Thank you. Mr. Kitchen, Dr. Kitchen.
Chair, in lieu of how long it's taken to go through where we've got to right now, I will defer the second motion to a later date.
Very well, thank you. That being the case, we will move to our witness testimony. Once again, thank you all for being here, for putting up with the interesting life that is Parliament, and your patience. And some of you I've seen before, and I welcome you back. And so we have 4 groups. Each group is able to present a 10-minute opening statement, and once all groups have made their statements, then there will be one or more rounds of questions depending on time. So first off is the Public Health Agency of Canada. We have Dr. Howard New, Deputy Chief Public Health Officer, and Cindy Evans, Acting Vice President, Health Security and Infrastructure Branch. Please go ahead.
Okay. Thank you, Mr. Chair, for the opportunity to update the Committee on FACTS, or the Public Health Agency of Canada's efforts to respond to the novel coronavirus, COVID-19, in Canada. A lot has happened since the last briefing on February the 5th. As you are aware, things continue to evolve globally in terms of the spread of illness and response efforts. There are now more than 80,000 confirmed cases globally and more than 2,500 deaths worldwide. Although China remains the epicenter of the outbreak, accounting for 97% of cases and the majority of deaths related to COVID-19, the spread of the virus is now occurring at the community level in several countries, and that is concerning. Jusqu'au présent au Canada, nous avons 2 cas confirmés.
To this point in Canada, we have had 12 confirmed cases, 7 in British Columbia and 5 in Ontario. Importantly, the 3 most recent cases, 2 in British Columbia and 1 in Ontario, are different from the other cases that we have seen in Canada to this point, in that there has been no link with travel to China, but rather to Iran. Despite this increase in cases around the world and more confirmed cases in Canada over the last few days, the risk of spreading the virus in Canada is still small.
That the outbreak will take. That is why, as we continue to monitor the situation and learn more about the spread of this virus, we are also planning for all possible scenarios and basing our response on evidence and science. We continue to believe that Canada's public health system is well equipped to contain cases coming from abroad and which will limit their potential for spreading within Canada. Our system is working as it should to protect Canadians against this novel coronavirus. We are ready to respond should we find ourselves in the midst of a global pandemic. We are acting now to ensure that we can shift our approach quickly, if necessary, from delaying spread as long as possible to pandemic preparedness and response. The Public Health Agency of Canada is working collaboratively with partners at all levels of government to respond to COVID-19, and to plan and prepare and adapt our response to this rapidly changing situation. Nous continuons d'adapter nos mesures.
We are continuing to adapt our border measures as the international situation evolves, ensuring that individuals have the information they need to protect themselves and their fellow citizens. We are continuing to request those traveling from the Hubei province to voluntarily isolate themselves, and to those coming from China to watch for symptoms. These people receive documents with key information and instructions in the airport on what will happen if they start to develop symptoms. There are general messages for all travelers as well from other countries, and the document asks them to watch for symptoms of COVID-19 and to communicate with local public health authorities if they have symptoms.
.ca/coronavirus, along with the latest travel health advisories on travel.gc.ca, so that all travelers, prior to departure and upon returning to Canada, can stay informed and know what to expect. This includes, for example, updated travel health notices for affected areas such as South Korea, Iran, Italy, Hong Kong, Japan, and Singapore. As the cruise ship season opens in April in Canada, the Public Health Agency of Canada will be proactively engaging with operators to reinforce obligations under the Quarantine Act and will provide public health travel advice to cruise ship passengers on infection prevention and control and what measures they can take if they become sick. We have also assisted Canadians in returning to Canada from highly affected areas. Jusqu'au présent, le Canada a affrété 3 vols.
Up to now, Canada has chartered 3 flights to bring people back from Hubei province in China, as well as passengers aboard the Diamond Princess cruise ship that was docked in Japan. I'm pleased to announce that all individuals who were in quarantine at CFB Trenton have now been released. All those in quarantine have been in isolation for 14 days.
Public health authorities and non-governmental organizations to ensure that social services were in place to support these Canadians and their family members after they left CFB Trenton. Repatriated Canadians from the Diamond Princess cruise ship remain in quarantine at the NAF Centre in Cornwall, Ontario, where they continue to receive the same regular health assessment and mental health supports as those who were under quarantine at CFB Trenton. To date, 4 individuals reported symptoms similar to COVID-19. Samples from all 4 individuals have been tested and confirmed negative. We will continue to provide updates to the community and all Canadians regarding these repatriation efforts and the health and safety of our fellow Canadians during their stay at the NAF Centre. Comme nous pensons à l'avenir, les restants
We are thinking about the future. We know that recent world developments are of concern, and we know that we need to consider how and when to adjust our approach. And I would now like to talk about our approach to the impact in Canada.
Containment, delay in preparation, and mitigation. While Canada's enhanced border measures and ability to detect, treat, and, through isolation and quarantine, limit the spread of COVID-19 have been effective to date, it is prudent for Canada to ramp up planning and preparations to be ready for all potential outcomes, including the possibility of a more widespread outbreak. This means shifting to a containment and delay phase. This does not mean that we currently think the risk to Canadians has changed. As I mentioned earlier, the risk within Canada remains low at this time. Cependant, nos efforts doivent.
However, our efforts must now be focused on preparing our health system, our communities, and our families for the appearance and the ongoing spread of the virus in Canada. This progression in our planning and response is part of the existing framework in Canada to manage public health events as they evolve.
It is in our planning and preparation for pandemic outbreaks that we're constantly working with partners from all levels of government. The Federal, Provincial, Territorial Public Health Response Plan for Biological Events and the Canadian Pandemic Influenza Plan, for example, serve as anchors in terms of coordinating our domestic planning and response. These plans were tested during our response to H1N1, and they were effective. However, we recognize that every event is different, and we must be ready for a variety of scenarios. We also recognize that it takes more than governments and the health sector to protect the health and safety of Canadians. Le moment est venu pour tous les Canadiens.
The time has come for all Canadians to think more about the need to prepare resources to manage a widespread community outbreak. Everyone, individuals, families, communities, schools, workplaces, and essential infrastructure, has a role to play in preparing for a possible increased spread of COVID-19.
Especially important that individuals continue to take actions to stay healthy and prevent the spread of respiratory infections, including washing their hands frequently, coughing into a sleeve or tissue, and staying home when sick. Being prepared also means staying informed. For the latest and most up-to-date information, Canadians should visit canada.ca/coronavirus or call our toll-free phone line at 1-833-784-4397 to get answers to questions about COVID-19. Alors que la situation continue d'évoluer et que
The situation is continuing to evolve, and the Public Health Agency is continuing to adapt. We are committed to providing updates and information as soon as it becomes available.
to ensure that the Government of Canada's response is comprehensive and effective, including being prepared for the possibility of a pandemic in the coming weeks and months. We would be pleased to answer your questions. Merci.
Thank you, Doctor. We go now to the Department of Foreign Affairs, Trade and Development. We have Ms. Heather Jeffrey, Assistant Deputy Minister, Consular, Security and Emergency Management. Welcome and thank you.
Thank you, Mr. Chair.
10 minutes.
As we've heard, overall, the preparedness and response activity for COVID-19 is being led by the Public Health Agency of Canada in close cooperation with Health Canada. And Global Affairs Canada is a part of those efforts with a specific mandate for the international dimensions of the response under the Federal Emergency Response Plan. Our primary responsibilities include the provision of consular services to affected Canadians abroad, the management of the international emergency responses that might be required in that regard, and the provision of travel information and advisories to Canadians. At our last meeting, we spoke of the complexity inherent in any infectious disease outbreak and of some of the barriers faced in delivering consular assistance to Canadians in these difficult circumstances. Over the past weeks, we have responded on multiple fronts, providing up-to-date travel advice, updated on a 24/7 basis, to supplement the travel health notices being issued by the Public Health Agency of Canada, providing information and consular services to traveling Canadians or Canadians resident abroad, repatriating Canadians in some instances, and developing new methods to extend consular support to those Canadians in quarantine abroad. In the case of Hubei Province, China, following the decision of local authorities to close transportation routes in and out of the province on a prolonged basis, the Government of Canada arranged 2 charter flights and also worked to place Canadians on U.S. charters that transported a total of 404 Canadians and their families from Wuhan, China to Canada. As noted earlier, all of these Canadians have now completed their 14 days in quarantine, and Global Affairs continues to provide consular services to Canadians in China through the Embassy in Beijing, our network of consulates in China, and the 24/7 Emergency Watch and Response Center in Ottawa. Global Affairs Canada also worked to assist Canadians affected by the quarantine of the Diamond Princess cruise ship. Following approval by the Government of Japan for the departure of foreign nationals, Canada worked quickly to charter an aircraft to repatriate 129 Canadians who are quarantined on the Diamond Princess. Those Canadians are currently serving a 14-day quarantine in Cornwall, Ontario at the NAV Canada Centre. All of the Canadians who have been repatriated were screened by medical personnel from the Canadian Armed Forces prior to their departure and were asymptomatic. And to date, there have been no cases of coronavirus confirmed amongst those passengers. Consular officials continue on the ground to deliver assistance to Canadians from the Diamond Princess who remain in Japan. There are 54 Canadians hospitalized across 24 Japanese hospitals. 43 of those are hospitalized for reasons related to coronavirus, while the remaining 11 have other medical issues or accompany family members in their quarantine. 11 Canadians have now recovered and been released. To assist in this response, our consular response team in Tokyo has been supplemented with additional specialized personnel from the Consular Standing Rapid Deployment Team, from the Public Health Agency of Canada, with medical personnel from the Canadian Armed Forces, and a medical liaison and psychosocial support team from the Canadian Red Cross. This integrated team is providing comprehensive consular services to affected Canadians, including visits to hospitals, medical liaison, translation, communications, addressing essential needs, psychosocial services, and a wide variety of other elements tailored to the individual needs of our consular clients. Our consular service is being constantly adjusted in line with the unique context of quarantine and isolation requirements for Canadians that find themselves abroad. As noted by the Public Health Agency, a growing number of countries have reported cases of coronavirus, I think 33 at last count. We've also seen additional border and travel restrictions in many affected areas, as well as flight cancellations by commercial carriers. Our travel advice is being updated continually in this regard, and we are urging Canadians to check the travel advice and travel health notices for their destinations before traveling, given that this situation remains extremely fluid. The travel advice pages for all destinations carry a link to the Public Health Agency's latest information pages and allow travelers to see how the country they are traveling to may have been affected. In addition, specific travel advice for China, Italy, Hong Kong, Iran, South Korea, and Singapore have all been specifically updated in response to coronavirus. Where Canadians encounter challenges abroad, our Emergency Watch and Response Center, as well as our embassies across the world, stand ready to provide further assistance as might be required. Depuis le début de cette situation,
since the beginning of this situation, the consular staff in Ottawa have been working 24/7 to answer questions and to help Canadians asking for assistance. Our call center receives a high number of calls and answers directly to help Canadians asking for assistance. We are also working with our health partners in the Government of Canada to make sure that all of the procedures and protocols are followed to protect our consular staff.
The situation, all essential services continue to be offered at our embassies abroad, including in particular full consular and emergency services on the ground to support Canadians. In closing, I'd like to add that Global Affairs Canada officials are continuing to work closely with health experts and our like-minded partners and are engaging fully in the medium and longer-term planning for responding to the eventual development of this outbreak. Thank you, Mr. Chair.
Thank you, Ms. Jeffries. We go now to Canada Border Service Agency. Calvin Christensen, Director General, Travelers Operational Guidance and Support, Travelers Branch. Welcome and thank you.
Good afternoon, Mr. Chair and members of the committee. I'd like to thank you for the invitation to appear today and provide an update on the additional measures that the Canada Border Services Agency has put into place since our last appearance here on February the 3rd. As you know, we are the first point of contact for all incoming international travelers, and as such, we support an effective multi-layered system that keeps Canada and its people safe. I would like to reiterate that under the Quarantine Act, Border Services officers are designated as screening officers as part of their normal day-to-day duties. International travelers also play an important role by holding responsibility to inform our Border Services officers if they are feeling unwell. Since the outset of COVID-19 outbreak, the CBSA has added enhanced screening and detection processes to our robust border measures to keep our officers and Canadians safe. We continue to maintain an open line of communication with Health Canada, the Public Health Agency of Canada, Global Affairs Canada, in this whole-of-government effort. As the CBSA briefed this committee on February 3rd, the following measures were put in place. Targeted signage in CBSA arrival halls, additional health screening to identify individuals who may have been in Hubei province in the last 14 days, the referral of travelers to FAC officials at ports of entry, the dissemination of information brochures advising travelers what they should do should they become ill following their arrival to Canada, and also ensuring that our officers are provided with and trained on how to use the personal protective equipment recommended by Health Canada. Travelers that answer positively to the enhanced screening question were and are still subject to additional screening to help prevent the possible spread of the disease. Those experiencing flu-like symptoms are referred to a FAC staff member, and all others are provided with information and permitted to continue in their travels. The CBSA also took steps with our colleagues at Transport Canada to remind airlines that under the Quarantine Act, they are required to report as soon as possible whether ill passengers are on board. This allows adequate time to put the proper precautions in place before the aircraft arrives at its destination in Canada. I'd now like to turn your attention to the additional precautions that we have put in place since the 3rd of February. So on February 8th, as mentioned by our colleagues from Public Health Agency Canada, the CBSA issued a new information brochure with more specific instructions for travelers who have been to the province of Hubei, China, to monitor themselves for symptoms, to self-isolate at home for 14 days, and to contact local public health of their within their area of jurisdiction within 24 hours of their arrival. Also, they're to contact again if they develop any symptoms within the 14 days. On February 9th, the enhanced border measures that we outlined before were expanded to all Canadian international airports. On February 14th, the CBSA provided its officers with updated occupational health and safety advice from Health Canada on the processing of mail from China, which includes the wearing of nitrile gloves and hand washing each time gloves are changed or discarded. The agency is communicating regularly with our employees, with the Customs and Immigration Union on the occupational health and safety measures, and we are ensuring that the appropriate personal protective equipment is readily available to be used where required. Also, as mentioned previously, on the 17th of February, all travelers who indicate that they've been in the province of Hubei are required to fill out a Public Health Agency of Canada contact form to allow health authorities to monitor and track those who have been in the impacted region. The form captures basic biographical data, flight data, and contact information for the passenger while in Canada. Once completed, the Public Health Agency determines when and how to share this information with provincial authorities if required. As of the 19th of February, at the direction of the Public Health Agency of Canada, Border Services officers began issuing surgical mask kits to all travelers who report that they have been within the province of Hubei. Throughout this period, the CBSA has been supporting federal partners in the repatriation of hundreds of Canadians from China impacted by this outbreak. On the ground in Wuhan, CBSA officers verified the identities and documents of passengers and ensured that a risk assessment of all passengers was completed prior to their departure to ensure no high-risk travelers from a security perspective were boarding the aircrafts. On arrival, CBSA officers processed the travelers through our normal border clearance processes. During this process, all appropriate measures were taken to ensure the health and safety of our employees and Canadians. To close, we continue to work lockstep with our partners in ensuring our responses at the border are in line with the current situation while protecting our workforce. Thank you.
Thank you. We go now to the Department of National Defense. We have Major General Cadieux and Major General Cadieux, Director of Staff, Strategic Joint Staff, Major General Downs, Surgeon General, Commander of Canadian Forces Health Services Group. Thank you, gentlemen. Go ahead, 10 minutes.
Mr. Chair, committee members, thank you again for the invitation to discuss the role of the Department of National Defense and the Canadian Armed Forces in the whole of government response to the evolving COVID-19 situation. With me again today is Major General Andrew Downs, our respected Surgeon General.
When I last reported to you on the 5th of February, our team was poised to support Global Affairs Canada and the Public Health Agency of Canada with the first assisted return of Canadians from Wuhan in China.
We've briefed the details of the assisted returns already. In the interests of time, I will not repeat that information. As part of these efforts, these assisted returns, your military has provided the following support to Global Affairs Canada, Canada Border Services, and Public Health Agency Canada over the last several weeks. First, we deployed multiple Canadian Armed Forces medical teams with each of those flights. These 6-member elements were tasked to conduct health screening of returnees as part of the aircraft boarding procedures and to monitor the health of returnees during the return flight back to Canada. 2 Canadian Armed Forces health professionals currently remain in Japan and are assisting Global Affairs Canada with the approximately 54 Canadians who remain in hospital. At home here in Canada, Canadian Forces Base Trenton provided the logistical framework within which Public Health Agency was able to coordinate public health measures, emergency social services, and security services with the province of Ontario for this period of quarantine as per the emergency order. That support included infrastructure for use by federal and provincial authorities for the conduct of their tasks associated with the quarantine period, ground transportation and accommodations, food services, which included the preparation and packaging of meals that were delivered by the Canadian Red Cross, and general duty support and limited augmentation to security services as contracted providers surged into Canadian Forces Base Trenton. For the most recent assisted return from Japan, D&D and CAF personnel provided the following additional support beyond the medical teams that I've already briefed, and that support is ongoing now. We planned and conducted the road move of all returnees by bus from Canadian Forces Base Trenton to Cornwall. In addition to providing the buses and drivers, CAF provided returnees with personal protective equipment and medical support throughout their journey. And in Cornwall, we're providing the architecture for a command and control node that's being used by our whole of government team, as well as continued general duty support. On to près de 200.
In all, nearly 200 CAF personnel have been deployed to support this whole of government effort, with countless staff also committed at various echelons.
Of our D&D CAF planning efforts that we're undertaking right now. D&D CAF continues to support whole of government planning, which is being led by Health Canada, and that includes efforts to contain, delay, and mitigate the impacts of COVID-19. Internally, our planning is focused on ensuring that we remain postured to provide support to other government departments while putting in place measures to protect the force. This could include additional directives and advisories, changes to the posture of the Canadian Armed Forces, preventive health measures, and the mobilization of additional materiel and personal protective equipment for our teammates. We are currently refreshing contingency plans for a larger domestic response and, of course, business continuity planning. In closing, Mr. Chair, of course, nothing is more important to D&D CAF than our home game. We remain poised to assist federal and provincial partners moving forward. Mr. Chair, ladies and gentlemen, Canada's Surgeon General and I look forward to taking your questions.
Thank you, General, and thank you all for being here and for your excellent information. We go now to questions. I think we have time for one round of questions. We go to Mr. General for 6 minutes.
Thank you, Mr. Chair. And it's unfortunate that Dr. Tam couldn't join us today. I know we were expecting her. It was a last-minute change to the agenda. We're hoping that doesn't preclude her from coming back to future meetings if we see fit. I'm also hoping that she made a statement the other day on CTV where she was asked about whether we should shut down our borders, and I'm hoping, Dr. Najou, you'd be able to answer this. And she stated, and I quote, "The more countries that are infected, the less effective and feasible it is to close our borders." I'm curious if this is some sort of admittance that the government should have shut down the borders when China was, from what we understood at the time, the only country that was heavily infected.
I can say not at all. We certainly understand that border measures are just one layer in a multi-system approach to prevent and hopefully control the spread of COVID-19 in Canada. It's never been understood or recognized that border measures alone will stop it, because we know that with this disease, as with many other infectious diseases, there's something called an incubation period. So someone could actually be harboring the disease or the virus or the bacteria and come into Canada feeling totally well, have no symptoms at all, and then only declare and then come forward with symptoms once they've actually entered the country. So our current measures in terms of the Quarantine Act has always been in place, so that any sick traveler needs to present to a quarantine officer, or at least a border agent and then a quarantine officer for further assessment. And if appropriate under the Quarantine Act, they can be forwarded for further medical assessment. the supplementary measures we put in place were certainly appropriate for what's happening in China right now. We won't go into the details in terms of the advice we're giving specifically for travels from Hubei province and also for mainland China. But I think the proof is in terms of what's happened in Canada so far. We've contained the virus. There's been 12 cases today in Canada. That's a relatively low number compared to other countries. And all of the cases are, I would say, are isolated, or at least isolated to travelers coming to Canada or their very close contacts. 9 of the cases coming to Canada were all linked to travel to China. And now the 3 most recent ones, which is quite interesting in many ways, are now linked to travel from Iran. So that's also reflected by what's happening globally in other countries and regions around the world. But Canada seems is well positioned to actually address any COVID-19 that may come to Canada.
Great, thank you, Dr. Naju. Just to clarify the comment, she indicated that her statement being that the more countries affected, the less effective and feasible it is to close the borders, essentially alluding to the fact that if there is only one country, then closing the borders would be an effective mechanism for containing the virus. In hindsight, I would think that possibly the I guess part of this discussion afterwards, looking at when we close the borders and at where we move to make sure that the borders are closed, I think is pertinent for your department, hopefully to consider going forward. Because my time is short, I'm going to move on to the next point I want to raise. There has been some concern raised, essentially at the beginning of the government's lack of a plan. We know the minister's been doing scrums and news conferences. Dr. Tam's been making the rounds, but it seems not everything that the minister or Dr. Tam has been saying has been satisfying Canadians in terms of the concern that's been raised. And then yesterday, the Minister of Health stated that we're no longer in a containment phase. So I ask you two questions. What phase are we in now if it's not a containment phase? And being that the government's containment phase plan was unsuccessful and I would say poorly communicated, can you share with us the plan for the next phase so that Canadians know exactly what's going on?
Thank you very much for the question. Maybe I'll just respond to the previous comment about the border measures. I can't speak for Dr. Tam, and I'm sure she'll have the opportunity to maybe clarify or speak for herself in terms of border measures. But it's not about closing the borders. It's certainly from a public health perspective, closing the borders has never proven to be effective in terms of stopping the spread or the introduction of disease into any country. What Dr. Tam, and I'm just sort of thinking what she might have been thinking about, is that border measures look at what's happened in other countries such as Italy now. With the spread in many other countries and regions, the supplementary border measures we've had up to date, which includes giving additional information to travelers from China, from Hubei province, you can imagine if that gets expanded to the list to Japan, South Korea, Italy, and so on, and then obviously the trickle-down effect into what provincial authorities may need to follow up on. That's the issue, and I think Dr. Tam was addressing. To your 2 points, as Minister Hajdu reflected on containment, yes, Canada, we're still in a good position to maintain our containment approach, but we do recognize and we're also cognizant of what's happening at the global level. So Dr. Tedros at the World Health Organization did indicate that the window of opportunity is closing. So at the same time that Canada is still maintaining its containment posture, if I could put it that way, we're also starting to prepare for a possible pandemic. So we can't do this with our eyes closed and not recognize what might happen weeks and months from now, which has nothing to do maybe specifically with Canada, but what's happening internationally. As I said in my opening remarks, we have 2 sort of foundational documents. There is what we call the federal, provincial, territorial plan for biological events in terms of a response plan. Lots of things are already underway, including a special advisory committee of the chief medical officers of health for each of the provinces and territories. We meet with them regularly multiple times during the week to actually look at issues, guidance, policies, programs we need to put in place to address COVID-19, and as well as something called the Canadian Pandemic Influenza Plan. This was based on previous experiences, including H1N1, and that's what we're now looking at in terms of forward planning. Just to take an example of the kind of things we're looking at, and I think it's the same for other countries around the world, it's looking at things that should there be widespread transmission in Canada and in many other parts of the world, we would be looking at measures such as what we call social distancing. Do we need to start looking at canceling mass gatherings of public events? Would there be things such as looking at what we need to do with schools and students attending schools and people sick in the hospitals and so on? So that's all in the future. We're certainly not there yet, but we are actually taking a close look and making sure we're prepared for that.
Thank you, Mr.
Sorry,
General.
Mr. Chair, just to clarify, I asked if there was a containment phase where we've now moved on. I believe the words that he used were containment posture.
So yeah, we're still in the containment phase.
We are still. The minister said we're not, but you said we are.
Yes, we're still in a containment strategy, but we're not solely fixed on that, and we're also, as I said earlier, preparing for a possible pandemic and further spread.
Okay, so there might be a text message we might want to see on that, maybe.
Dr. Palumbo, 6 minutes.
I'm not sure who to address this to, but am I correct with this? The enhanced measures in terms of brochures, masks, forms that people have to fill out, those enhanced measures only apply to people who specifically have come from Hubei province. And the same with the recommendation to self-isolate. It's only Hubei province.
That's right.
That is correct.
So my further question is, why not the rest of China? I mean, clearly there's numerous other provinces with thousands of cases of coronavirus. Why not them? Why not South Korea? Why not people who've specifically come back from, is it QOM, QOM in Iran, the Lombardy region of Italy, places that we know there's been outbreaks?
Just to add to what Ms. Evans has said, the direction or the advice for self-isolation is for travelers coming back from Hubei province. But for mainland China up to now, there's also been advice given that you should be monitoring for symptoms in the next 14 days, if they have been obviously coming from mainland China in the past 14 days. And should they be coming down with symptoms consistent with COVID-19, they should obviously contact local public health. We've had a discussion, as I mentioned, with our special advisory committee and with our travel health advice. We're now going to go forward and also give that same advice to travelers that come back from the other 6 countries we're now adding to what we call an affected region list, being Hong Kong, Singapore, Japan, Italy, Iran, and South Korea.
Okay. A second thing, I would kind of question your reference to our containment with respect to H1N1 as being kind of the model and that being effective, having been an emergency doctor both at the time of SARS and H1N1. The precautions we took in terms of infectious diseases with SARS were totally different from H1N1. I mean, with SARS, we gowned up, we masked, we did everything. H1N1, I can't recall anything very much. So I would have thought that if we're looking to something to compare it to, it would be what we did with SARS rather than H1N1. And I guess to go along with that, how much are we using the expertise of the people who were involved with SARS to inform the decisions as to how to deal with the coronavirus?
I'm just trying to think myself. I'm actually also a veteran of SARS, so I guess one of those people who was involved with SARS and H1N1, as with many other physicians and public health experts across the country. I would say that yes, we are leaning on people who've gone through those based on their experience, and we are using their expertise. One of the key things I think we're doing right now, as I mentioned before, is there is a special advisory committee which consists of all of the chief medical officers of health from each of the provinces and territories, and they themselves have obviously their experts, their own staff supporting them. A layer below that, I'm actually the chair of something called the Technical Advisory Committee. So many of the scientific questions, the recommendations, the programs and policies that need to be developed and then sent to the Special Advisory Committee for their review, consideration, and approval is actually worked up at this technical committee. And for that, there's actually representation on this on this Technical Advisory Committee with representation from even the 3 key provincial public health agencies, the British Columbia Centre for Disease Control, Public Health Ontario, and the INSPQ from Quebec. So we are harnessing all of the expertise across the country.
Oh, okay, so the question I'd really like to get in is do you have enough resources, both with the Public Health Agency and the provincial ministries of health? I don't, in my experience, feel like there's a lot of excess fat on the healthcare system as it is. This is certainly, if there's any substantial outbreak, going to be a lot of work for a lot of people, both in public health in terms of contact tracing, ensuring people who may have been in contact and have symptoms self-isolate. Certainly it's going to be a massive burden on the hospitals and hospital resources in terms of number of beds, negative pressure rooms, ICU beds, ventilators. Do you at the moment, now I know we don't know where this is going, but I think you certainly have to be gearing up for the possibility that things are going to get worse. Even at this stage, in terms of gearing up, do you have enough resources in terms of people and money to be doing your job adequately?
That's a tough question. If I just, for me, myself personally, I could always use more resources, more money, but that's just myself. As part of the Public Health Agency of Canada and also the Government of Canada, I would say that we're doing well. I think obviously, as I said, it's always nice to speculate what you could do with more resources. But certainly, as you can see, in terms of the whole of government approach and what we've been doing to date, I think we've been successful to date. Not to predict what might happen in the future if the global situation changes, but so far so good. As far as the healthcare system, it's difficult for me to comment because, as we all know, that is a provincial responsibility in terms of the healthcare system, resources, and so on. But we are obviously discussing that with our chief medical officers of health, and they themselves are also very cognizant. They're in contact with their physicians and frontline workers to see what could or should be done and what can be adjusted.
Yeah, I guess maybe the bigger question is, okay, maybe in the Public Health Agency of Canada, but when it comes to the individual work at the public health level, it's going to be done by what are basically municipal agencies and the provinces, the hospitals, and have they do they have any added sources of funding to start to be addressing the possibility that things are going to get worse, let alone to actually maybe put into place some backups so they can respond? Certainly Canada, I don't think, has the capacity to build a 1,000-bed hospital in a week like China did. Ventilators, you can't just go
Dr.
buy them at the
Pulaski,
corner
can you
store.
wrap it up?
So do they have the resources?
It's difficult for me to comment because it is a provincial responsibility. I would say that the Government of Canada and the Public Health Agency of Canada, we do have what we call surge capacity support. So should a province require additional support, maybe for some equipment we have in our National Emergency Stockpile System, we're certainly able to meet that request. But in terms of speaking to the resource requirements, et cetera, in individual or provincial healthcare systems, I can't comment.
Thank you, Dr. Pulaski. We go now to Monsieur Beaulieu. Beaulieu. Merci. 6 minutes.
Thank you. 6 minutes. You have said a number of times that you have communications measures that are effective between you and the health authorities in Quebec, the provinces, and the territories. Carl West, who is a well-known expert in Montreal, has said that he has not seen any effective coordination on the part of the federal government. How can you explain this? What are these coordination measures that you have put in place? Can you give us a detailed plan of that, please? It's difficult for me to comment on what someone else has said on Radio-Canada, but we are working closely with the authorities in the provinces and territories. I am the head of the Technical Advisory Committee that involves representatives from all of the provinces and territories, and we're working very closely with the Quebec representatives, and we have had very good exchanges in our technical committee. We've had recommendations and special advice updates. And I mentioned the Federal, Provincial, Territorial Group on Biological Events. This is as well a part of our coordination, and we have good cooperation. The same virologist at the Jewish Hospital, Dr. West, has said that we may have to take drastic steps to put communities in quarantine, as has been done in northern Italy. What do you think about that? I can't really comment on this. I respect him as a virologist, but I work, with all due respect, with public health experts, so other health authorities can have their own opinions, of course. But we are not in that situation in Canada right now, so it is difficult to predict the future, to know how the virus will spread, to know how communities in Canada will be affected. So far, we have effective measures in place. We have not had spread. We've only had some cases that have been brought to Canada. Do you have what is necessary to deal with that? That's part of our discussions. If a situation arises anywhere in Canada, we will deal with that situation. Right now, it's hard for me to say exactly what would be done in that kind of situation. We'd have to look at the circumstances and all the facts of the case, the scientific data, and that would be what we would base our decisions on. I have a question that may be more for the Border Services Agency. A few days ago, a woman came from Iran through Montreal to BC, and she was diagnosed in BC as having COVID-19. So I would like to know how effective the measures to screen people are in the airports, because she was not found to have symptoms in Montreal. She was not screened in that way. So how was she missed? Why did she escape notice?
Question. The traveler arrived in Montreal from Iran, and the information we have is that she arrived on the 14th of February. On or around that time, we had no prior indication of what was actually going on in Iran. And we weren't paying any special attention to others than what we have in our primary inspection kiosk questioning for the Hubei province. We did go back and look at the situation of when she came through, the type of contact that she had with her officers before then she moved on for her flight onward to Vancouver. It was a very brief interaction that she had, as is with many travelers that come through Canada. She wasn't asked specifically if she had been to Hubei, obviously. She wasn't observed as having any outward illness of any sort at that time. And she progressed through the border clearance process as many travelers would on a daily basis. So there was nothing abnormal about her when she arrived. And then she became symptomatic, I believe. I'm not sure when she became, whether she was asymptomatic at the time when she crossed, or whether she became symptomatic later. But just as a follow-up also, when we did receive information regarding this particular traveler, we went back into our systems to see exactly when she arrived, how she processed through the airport. We contacted our officers that encountered her to just advise that they had been in brief contact with the person, and advise them to take appropriate precautions to call into local health authority if they start to notice any change in their physical behavior.
Merci, Monsieur Boulon. Ms. Kwan, 6 minutes.
Thank you very much. Just to follow up on that, since the BC medical health officer has just made this public, notices have gone out to schools in Coquitlam, Port Coquitlam, and Port Moody, which is the Tri-City in British Columbia, as well as other Fraser Health areas in British Columbia, and this is to deal with the case of the woman from Iran who may and I think warning folks about potential concerns of anyone who has been in close contact with this woman in British Columbia. So given that that's the case, there are now notices in schools in British Columbia about this. And so precisely to the point, because the screenings could be missed, because a person could be asymptomatic or have mild symptoms and be missed because they have not traveled or are traveling back from Hubei province. And now it's in an area in British Columbia potentially wider than what we anticipated to begin with. So in light of that, what measures should Canada be undertaking to address these kinds of concerns? And as we now hear that the issue is that it may well be a pandemic, right? And so now the Minister of Health just today said is encouraging Canadians to stockpile food and medication in their homes in case they or a loved one falls ill with the novel coronavirus. And so I have a question about that too. If the minister is encouraging people to stockpile food and medication, how much food should they be stockpiling? How much medication should they be stockpiling? Should they be stockpiling surgical masks as well? In Hong Kong, in China, elsewhere, the shelves have become empty and people are literally desperate to get these items. So I'm just trying to trying to get a sense of statements like this means what for Canada? Anybody on the panel, please.
There's several elements to your question, so maybe I'll start with the one last about the pandemic. If there is a pandemic, it has yet to be declared by the World Health Organization at the global level. As I mentioned earlier, Dr. Tedros, the Director General, is indicating that the window of opportunity for containment is closing. But at the present time, it is not, in his opinion, a worldwide pandemic. Having said that, we recognize that there's certainly a widespread outbreak in several parts of the world, but not yet in Canada. So in Canada, with our 12 cases, we're still in containment mode. I can't speak for the minister, but certainly my sense is that she, along with Dr. Tam and myself and other officials, I think part of our job is also to, sensitize the public that, hey, we're still in containment phase, but we have to start preparing. We have to look at all potential outcomes, and if that includes making sure that you have your medications up to date, you have an adequate supply at home. That's all part of it. So that's one thing. Your other point about what the BC health officer did with school notices, I can't speak for Dr. Henry, the BC health officer. My sense might be, if anything, in terms of education awareness for parents, in terms of trying to dispel any sort of fear or stigma and discrimination. The case, from what we know, as soon as this case was identified, diagnosed, this person was put into isolation. And it was then undertaken by BC officials, contact tracing, doing a close investigations of people who were close in contact. And that turned out to have another case. Other than that, my understanding is that everything else is being followed up appropriately by BC officials, and there's no evidence at the present time that it's widespread in British Columbia.
So on this question about stockpiling, from your medical expertise point of view, how much should people be stockpiling? For 1 week worth amount of food? 2 weeks? Should they be loading up on surgical masks as a preventative measure? What exactly does that mean? I'm just trying to understand from a medical point of view.
Well, I think at this point myself, I would say that those kinds of questions about what kind of measures individual Canadians can take, I think that would be probably a good topic, as I said, in terms of our ongoing discussions with our our counterparts, the provincial and territorial authorities, in terms of what kind of measures, recommendations we would make, both at a sort of government and organizational level, but also for individual Canadians. I'm not in a position to comment.
Thank you. All right, so we don't have an answer for that, despite the minister said this. My other question then is this: in terms of preparing for potentially the spread of the virus, what measures are undertaken to prepare communities that might have insufficient resources to deal with a potential outbreak? For example, in Indigenous communities, for lower income communities, for example, what measure is being undertaken to ensure that they are preparing for potential outbreak?
Well, at this point, I can't give, I don't have all of the details, but there is a whole of government approach, and there is regular ongoing interdepartmental meetings to look at issues such as this. And even within the public health community, we are actually working closely with our partners, Indigenous Services Canada, to look at issues that might apply to, let's say, remote Indigenous communities, the same kind of issues that came up during H1N1, and certainly that's part of our thinking moving forward.
Is anybody in contact with other departments, for example? So we're asking people to self-isolate and self-quarantine, and which would mean that people would have to miss work, and there are also implications potentially for them to actually be fired. We actually heard last week from Toronto of those kinds of situations occurring. Is the whole of government approach dealing with other departments in terms of looking at potential support for employees and potential employers and businesses that are impacted by this? We know that, for example, the restaurant
Ms.
business.
Kwan, could we wrap it up quick?
The short answer is yes.
So if the answer is yes, I wonder, can that information be brought back to the committee and be shared with the committee? And on that note, last time when I was here, I asked a question about asymptomatic and about contacting China directly about the potential spread of the virus for people who are asymptomatic. I wonder if we got a response for that, because I'm still waiting. And I just think that, all of this information would be very useful and helpful for us to know the facts.
I can respond to it. In terms of the question of asymptomatic transmission, but also the request to China, as we all know, there was a special WHO mission. A lot of experts led by Canadian Dr. Bruce Elwert, who's just recently returned from China. A lot of intensive discussions and much more effective in terms of gathering data, working with Chinese officials. And imminently a report will be coming forward from that special mission. And ourselves and people around the world will obviously be looking at that report carefully to look at...
Sorry, I just want to quickly respond. I know that the WHO is intensely working on this and trying to gather information. My question last time was asking the Canadian government to contact the Chinese authorities directly for this information.
So I recommend you follow up with the minister. You go ahead, please do.
Sorry, this was actually brought up at the committee last time when I was here to you, Mr. Chair, and to this committee, and I think the committee undertaken to actually seek that information on behalf of the committee.
I did say that we would ask the minister about that, and I believe the minister and her department have contacted you directly in this matter since. So
I have not received a response on that.
Thank you. So that brings us to a close. Our time is up. Thank you all very much for coming here at such short notice and giving us excellent information. And thank you for your patience. And perhaps we'll see you all again. Thank you. Adjourned.